Welcome to Lancaster University and welcome to the Sports and Exercise Science Open Day here. My name is Dr Bob Lauder and I'm the Director of Sports Science here at Lancaster University. I'm speaking to you from our Human Performance Laboratory. This is our specialist space where, as a student, you'll have an opportunity to learn the skills of sports and exercise science. It's a teaching space as well as a research space. And later this morning, as part of our open day, you'll have an opportunity to see around our space. And my colleague, Dr. Michelle Swainson, will talk to you about the equipment that's here and how that connects with our degree scheme. We're going to also introduce the Director of Admissions here at Lancaster, Dr. Chris Gaffney. And he'll talk to you about the degree scheme that we offer. You'll learn how the degree scheme is assembled, you'll learn about the modules that you will take with us, and you'll learn what differentiates our sports and exercise science degree from many others. You'll learn about the small class sizes and the way in which we deliver from a medical school. We are one of a very small number of sports and exercise science degrees in the UK, which is delivered from a medical school. We know also that you'll probably have some questions that you'll want to put to us. So please, as the day progresses, just drop those into the chat. And there'll be a couple of question and answer sessions where we'll have an opportunity to address those questions. We want to be sure that by the end of today, you've had an opportunity to learn about our degree and why this would be the sports and exercise science degree for you, but also to have any questions that you've got answered. But before we get started, let me just spend a moment talking a little bit about sports and exercise science here at Lancaster University. We're a very young degree. In fact, we're very pleased to have our first graduates graduating from our degree. And this morning, you'll have an opportunity to hear from one of our graduating students, Glenn. There'll be an opportunity there to hear from Glenn about his experience of being a sports and exercise science student here at Lancaster University. I mentioned already that we are one of a very small number of sports and exercise science degrees that's delivered from a medical school. And this leverages the clinical connections that we've got, and those assemble into the degree. Sports and exercise science degrees open extraordinary opportunities for our graduates. We know that our first set of graduates, many of them are moving on to research careers or to work within the sports and exercise science domain, either within the sports domain or within the exercise and health domain. As we think about the very challenging year that we've had, dealing with a pandemic, one of the key things that's come across is the importance of exercise. The importance of exercise for our physical health and the importance of exercise for our mental well-being. There's always going to be roles for sports and exercise scientists who can support people in taking exercise. And those sports and exercise scientists are going to be most effective when they understand the practical applications of their subject, but also when they understand the theoretical background, when they understand why they're advising a client on a particular exercise program. And our graduates, our students, as they take their sports and exercise science degree based in a medical school, are going to be uniquely positioned in that domain. I'm going to now pass over to my colleague, Dr. Chris Gaffney, who's the Director of Admissions here at Lancaster University for our Sports and Exercise Science degree. And he's going to introduce you to the details of our degree. As he's doing so, you might have some questions, and so please drop those into the chat and we'll have an opportunity at our question and answer session to address any of those questions. But for now, allow me to introduce Dr. Chris Gaffney.
Okay, thank you very much for that introduction. So as Bob's mentioned, I'm Dr. Chris Gaffney. I'm the Director of Admissions here for Sport and Exercise Science. I'm going to give you an overview of our Sport and Exercise Science programme here at Lancaster Medical School. Next slide, please. So to start off, you'll be studying Sport and Exercise Science should you choose to come to Lancaster Medical School. It's a very high-ranking university, so we're top 10 university in 2 of the 3 major league tables. And this is a signal of some of the quality that our programme has. We're aiming to develop some of the sport and exercise scientists of the future, and we're doing this by integrating within the medical school and using some of that clinical expertise that we have within that. So on this image that we've got here on the right hand side, we've got one of our anatomy practicals that's led by Dr. Sarah Powell that we're leading some of the Q&A sessions after this. And we've tapped into some of that expertise within the medical school by getting one of the surgeons within our environment to lead one of the dissections. So we really try and work with a range of different specialists, from world-leading bioscientists and clinicians to sports physiologists, anatomists and other sports sector professionals. Next slide, please. You will be part of this medical school environment. So as Dr. Bob Lauder has mentioned, you're one of a handful of sport and exercise science programs within the UK that are delivered from this medical school setting. We are part of a growing faculty here at Lancaster University. So the university has recently invested over £40 million in a health innovation campus that sport and exercise science is part of. Just an exciting time to be part of sport and exercise science and Lancaster Medical School. One of the key aspects I want to get across from today, and hopefully Glenn might speak a little bit to this later in the questions, is that a lot of our teaching is done in small cohorts, and this is very deliberate. We choose to have quite a small course here at Lancaster University, and this is so we can give you significant practical experience to learn those hands-on techniques that you need to become an excellent sports and exercise science practitioner. Now, you may be familiar with subject league tables and so on, and because we are this new sport and exercise science course, we're not yet in the league tables for sport and exercise science. But I've put these data at the bottom to illustrate how we are high ranking in other domains, so you get an indication of where we hope to be when we finally return within sport and exercise science. So we're #1 in the UK for research quality within medicine. So you've been taught by the best researchers that we have within the UK in this domain. We're #4 in the UK for teaching quality in medicine. So the academics that are teaching on the sport and exercise science programme are also teaching on medicine as well. So you get this idea that the teaching quality is outstanding, and indeed we've got a TEF Gold rating indicating that our teaching standard is the highest that it can be. And finally, at the bottom, we're #1 in the UK for research intensity in medicine. So the volume of research that is going on is as high as it can be, and these are all from the Complete University Guide 2022, so very high ranking in that domain. Next slide, please. You learn in various different specialised learning environments. So lots of your learning will take place in this human performance lab that we have here. And this is the same for physiology, nutrition, biomechanics and psychology. You do lots of practical based activities here. We also use specialised learning environments across the university as well. And the important thing is that this environment here is used for both teaching, research and consultancy. So you as a sport and exercise science student will be using the same type of equipment that we're using for our consultancy work with elite athletes and for our world leading research as well. Next slide, please. You'll also learn in our state-of-the-art labs across the university. So we've got our bioscience laboratories. You'll use these in part of the year 1 modules, in modules such as molecules of life and cell structure and function. You also have some optional modules within the 3rd year, such as biology of aging, for example, or medical genetics, and you can use those colleagues in biomedical and life sciences, and you can tap into that expertise and take modules in that domain should you wish to as you tailor your degree programme. Next slide, please. The other specialised environment that we have is our strength and conditioning suite. So this is a new facility that was opened around 18 months ago. And part of this is around working towards an industry recognised fitness qualification that we've embedded within the 1st year of the programme. The idea of this is that we're giving you the skills that you need to be employable, and we're developing these from the start of your degree programme. You'll gain experience within a fitness environment, and these of course are really useful for enhancing your CV, and I'm more than happy to answer any questions that you might have around that. Next slide, please. So with any sport and exercise science degree programme, you have these 3 core disciplines. So in the top in red, we have anatomy and biomechanics. In blue, we have physiology and nutrition. And on the right in green, we have psychology. Now, for most sport and exercise science programs, you have this sport performance line. So how do you apply these to an elite athlete to make them as fast as they can be, to make them as strong as they can be? We can also apply these very same skills to health performance. So how can we improve public health? How can we help somebody manage their type 2 diabetes? How can we manage somebody on a recover from a heart attack, for example? So we have these two strands within our degree program, and we believe it's really important to give you these skills within the health domain as well, just because of the opportunities for employment that there are, particularly in that domain, is growing significantly. Next slide, please. It's really important that we engage you in professional practice throughout your degree program. So we encourage you to engage with communities, the NHS, clubs and industries throughout your degree program. We'll also encourage you to engage with key organisations such as BASES, so the British Association of Sport and Exercise Scientists. And here on the right hand side, we've got an example of some of the companies and other domains that we're working with currently. So, for example, Swim England Northwest, we've got some of the logos from some of our university sports teams where our students are working as applied sport and exercise scientists. We've got the Big Bang there as well. So this is one of the largest science outreach programs we've got within Europe. So really exciting opportunities for our students to be involved in. Next slide, please. In terms of our degree program, there's 3 years, there's 3 terms, and there's 3 core disciplines. Next slide. Within year 1, there are more modules, but these are worth lower credits. So starting off in weeks 1 to 5, we have becoming a sport and exercise scientist, we have fundamental anatomy, and we have molecules of life. Within weeks 5 to 10, we have concepts of sport and exercise psychology, principles of biomechanics, and then cell structure and function. You'll note that on the right hand side, we've got cell structure and function and molecules of life. These are our modules within biomedical and life sciences. So these are giving that molecular underpinning that we need for the later years within the degree program. In weeks 11 to 15, so coming back after the Christmas break, we've got introduction to nutrition and essentials of sport and exercise physiology. You've then got week 16 to 20, we've got public health challenges. So again, applying those sports science skills to that public health domain. We've got hormones and metabolism with myself. And then finally, after the Easter break, weeks 21 to 25, we've got assessing technologies in sport and exercise science and exercise prescription. And you'll see on the far right hand side, there's this professional practice module. So gaining the skills that you need to be an applied practitioner. This runs all the way throughout your first year of your degree program. Next slide, please. In terms of the way that our sessions are taught, so typically within the first year, there's typically 5 weeks of content for an 8-credit module, and these are delivered as 4 weeks of talk component and then a week of assessments and revision. So for example, if we look at molecules of life, there are 3 sessions per week that are lectures of 1 hour. You'll have 1 workshop per week of 2 hours, then you'll have your weekly directed tasks. If we look at a module that's maybe slightly more practical, so something like essentials of sport and exercise physiology, so where we really need to get you in the lab and learning those practical skills to be an exercise physiologist, you just have 2 lectures per week of 1 hour. You'd have 2 2-hour lab sessions within the human performance lab, and then again you would have weekly directed tasks. Year 2 and 3, so progressing throughout your degree program, they're typically 10-week modules and they typically be 15 credits. And those tend to work on this model of 9 weeks of talk components and then a week for assessment or revision at the end. Next slide, please. Within the second year, we've got our core modules. So we've got biomechanics, physiology and metabolism, sport and exercise psychology, research methods and statistics, current debates in sport and exercise science. You get your opportunity to pick your first option module. So you choose 1 out of the 2 of sports medicine or exercise medicine, so that performance or the health pathway. And we've got, again, a year-long module in professional practice, giving you those practical skills you need to be an applied sport and exercise practitioner. Next slide, please. Finally, in year 3, you pick 2 out of the 3 of your core modules, so biomechanics, advanced physiology, or applied sports, exercise and performance psychology. You also select 1 option module out of maximizing elite performance, optimizing health outcomes. So these again are our elite performance or our health pathway. And then, as I mentioned earlier in the talk, you can pick modules within biomedical and life science if you choose to, such as medical genetics, neurobiology, or biology of aging. And our year-long modules are going to be the research project, where you do an independent piece of research within the sport and exercise sciences, and professional practice, again, giving you those skills ready to get into the workplace. Next slide, please. In terms of our approach to assessment, as a director of admissions, and certainly as a course overall, we're very aware that people come to us with a range of different qualifications. So over the entire degree programme, we try to have struck a balance between roughly 50% examination and 50% being coursework. So as an example, we've got here from our first year module, an introduction to nutrition that I lead, we've got 10% of the overall module grades comes from these online knowledge tests. So these are weekly, they're worth 2.5% each. They're commonly used at Lancaster, and they're actually an assessment for learning. So you should be getting 100% on this small component of the module. 60% of the module grade is from dietary analysis. So this is doing a dietary analysis report on an athlete, on a friend, on a family member, and using this real life case study data and submitting it at the end of the 5th week. So learning how to do these dietary analysis techniques. And then finally, you'll have an end of year examination, which will be worth 30%. So you can see there's roughly this 50-50 balance, and this is similar across other modules. Next slide, please. One of the things we're really fortunate here at Lancaster is we have the collegiate system. So we're one of a few universities, all prestigious universities, that have this college system. So as part of joining Lancaster, you'll be assigned a college that you will be part of. And this means that you'll have your academic tutor, so one of the members of the sport and exercise science team is here to guide your academic studies and to be there to help with any pastoral issues as well. But it's really nice that you'll get a named college tutor as well. So if there's anything that you want to talk about that you want to keep separate to your academic studies, you're able to do this because of the college program that we have. Next slide, please. One of the most frequent questions we get is, what sort of career can you go into being a sport and exercise science graduate? And the exciting thing about sport and exercise science is the whole range of different careers that you can choose to go into. So starting off on the left-hand side of this table, we've got things that are very course specific that we're preparing you for throughout the degree programme. So these could be being an applied sport and exercise scientist. It could be being a performance analyst, some sort of fitness professional, a sports psychologist, and so on. We've got things that are related that may require some further postgraduate study. So for example, becoming a sports therapist or a physiotherapist, becoming a physician associate. You could go into teaching, could go into clinical trials management, or indeed go into things like academic positions. And most of these in the middle are very highly related to our degree programme, but they typically require further study, whether that be master's, PhD, or continued professional development on a job. On the right-hand side, we've got these transferable skills, and doing a sport and exercise science degree, because of the range of different assessments that we have, the skills that we give you throughout the programme, you're very appealing to a range of different things that are nothing to do with sport and exercise science. So for example, people have gone on to have successful careers across the sport and exercise science domain in things like the emergency services, the military, recruitment, nursing, and other things that we have on there. So these transferable skills are really, really important. Next slide, please. In terms of our entry requirements, our headline offer for A levels is 2 A's and a B, and at least one must be in a science-based subject. GCSEs, we look for a maths grade 5 or B, and English language grade C or 4. Just going to cover BTECs because I'm aware that lots of people at level 3 come to us with BTEC qualifications. We typically look for distinction in sport and exercise science, sport performance and excellence, or applied science. We do accept BTEC sport, but what I would say is I tend to have a look at the science content because we want to make sure that you've covered sufficient science content so that you're prepared to join us in the first year. So if you have any questions about that, more than happy to deal with those. Either if you're happy to ask the question, or alternatively, please just drop us an email and I can take a look at that content for you. Next slide, please. We're very fortunate within sport and exercise science that we have these ability to offer our own scholarships. So these are in addition to the Lancaster University Excellence Scholarships that are for high grades and other things as well that can be found on the scholarships pages of the university. And this is where we're allowed to award £3,000 per year or £9,000 across the course of the degree. There is an application process that's involved in this. We tend to give more details around this around our offer holder events, but it's just to mention the fact that we do have this exciting opportunity of being able to give away scholarships every year for our programme. Next slide, please. If you'd like any further information, you can drop us an email, so undergradadmissions@lancaster.ac.uk, or the medicine email address that we have there. You can give us a call. I'd always recommend following us on social media, so that's incredibly useful just to see what the latest research that's going on within sport and exercise science, seeing what some of our students are up to, whether that's placements, whether that's activities that they're involved in. Then finally, just at the bottom, we've got campus and facilities tours. And this is that there's an opportunity to have a look around some of the facilities around the university. So I'd recommend looking that on the website address there. Next slide, please. Thank you very much for listening. I hope you found that informative. And with that, I'm going to introduce Dr. Sarah Powell, who's our Director of Part 1 and who's going to lead the question and answer session that we've got coming up.
Hi there, everyone. It's really nice that you've tuned in to be with us this morning. I hope that has given you a really good insight into the programme and an overview of what to expect. I'm going to give you a little bit of time to add questions into the chat if you'd like to, because it'd be wonderful for me to read those questions and to put them to individual members of the team. And while you do that, I would like to introduce, we've already mentioned him, one of our wonderful students, Glenn Sherwin. He's our 3rd year who's finished all of his exams and is ready to graduate to a wonderful future in this field. We're incredibly proud of the progress he's made, and I'm going to pass over to him so he can say hi to everybody.
Hi, thanks Sarah. Yeah, so hi, my name's Glenn, and I'm a 3rd year on the Lancaster Sport and Exercise Science course, and as Sarah said, you know, I've loved every minute of the last 3 years, and I'm going to be moving on to a master's program in physiology and nutrition and seeing where future can take me off the back of this wonderful program.
Okay, so I'm going to start directing questions, and I'm going to hopefully choose the best person placed to answer those. So thank you very much, and keep the questions coming. The first question that we have is one that is obviously on everybody's mind, and that is COVID and how COVID's affected our degree. It's in the news, we're all talking about it. Is it a good time to start university? And I'm going to send that over to Bob as Director of Sports Science.
Thanks very much, Sarah, and thank you for whoever asked that question. It's a really important question. I understand absolutely that as someone thinking about coming to study in 2022, you want to understand the impact that the COVID pandemic may have on your studies. We understand that students right throughout their education have been disrupted because of the pandemic. All of us have had our lives disrupted. Here at Lancaster, just like all other universities, because of the lockdown restrictions that we've had in place, we had to modify the way in which we were delivering our teaching and learning. Because we weren't permitted to come into the university for periods of time, we pivoted. We pivoted to online learning. When we were able to come together, we've had physical distancing restrictions put in place. And again, the Sports and Exercise Science team here at Lancaster have worked really hard to redesign, to reimagine our teaching and learning, to enable that to happen safely within our teaching spaces, like the Human Performance Laboratory. I think one thing that we have had that's been in our favour is the small class sizes. We welcome a relatively small number of students to come and join us here to study sports and exercise science at Lancaster University. And because of that small class size, we've still been able to have some in-person sessions. However, we understand absolutely that the COVID pandemic has impacted everybody's learning. But we hope, and I'll be interested to hear what Glenn has to say in just a moment, but we hope that we've been able to maintain that high quality experience for all of our students, so that even though, like all universities, we've had to change the way in which we deliver our teaching and learning, the way in which we interact with our students, we've been able to maintain that connection with our students. We've been able to maintain that delivery of the high quality. And although we've had restricted opportunities to be in our learning spaces, we've still been able to deliver the skills and competencies that our students need. Perhaps Glenn might like to say a word or two about his experience over the last year. Glenn.
Yep, thanks, Bob. Yeah, it's definitely not been an easy year by any stretch of the imagination. Obviously, everything changed pretty much, but I think it's definitely important to note how accommodating the sport and exercise science team have been able to be throughout the past year. Given the small class sizes, as Bob said, we were still able to get the majority, if not all, of our physiology lab modules towards the start of the year. And sort of coming towards the end of the year, as we're sort of thinking about how everything has been in the last 12 months, we realized that we actually haven't missed out on anything. Obviously, it's nice to be in person, to be, interacting with each other and things like that. But in terms of the knowledge, the expertise and the practical skills and things, that's all still been able to be provided, and everything. So, for example, lectures and workshops were able to be online, but that still was able to create the sort of the social community with we all working together, and we were all sort of a team in this new situation together.
Okay, that's great. Thanks ever so much for all of that wonderful information. I have two more questions that have come in, which I'm going to kind of link together. People have mentioned several times the small class sizes that we have. So could you actually tell us how big we would expect the cohort on entry next year to be? And that, I think that ties into another question, which is what sets us apart from other courses of a similar nature in the UK? Maybe Chris. Let's go to Chris for this.
Thank you, Sarah. So taking the first part of the question, in terms of what we anticipate our class sizes to be for when you join us, if you choose to join us here at Lancaster Medical School, I'd anticipate our numbers will be between 30 and 40 students. So this is a relatively small cohort that you would be part of. I think the thing to emphasise is we're deliberately small. We're small out of choice. It isn't because we can't get the students. We have a huge range of applications wanting to come here to Lancaster. We want the best students. We want to make sure that we can teach you in a way in those small class sizes, and we can only do that with having relatively small numbers. And I think in terms of the question that's linked to that, in terms of what sets us apart, I think there's loads of things that set Lancaster apart. I think the very high-ranking institution, one of a handful of top 10 institutions, that instantly separates us. Being part of a medical school environment, so tapping into the expertise we've got from surgical colleagues, medical colleagues, I think that's really important. But I think for me, and I'd hope Glenn would agree, having gone through the programme, the most exciting part for me is this teaching in small class sizes. So typically when we have people here in the Human Performance Lab, we'll have a maximum of 20 students in any one class. And certainly having that cohort of 30 to 40 students, it's a relatively small class size. So you get to know your cohort, you get to do hands-on lab experience, and you're developing those skills in a way that isn't possible if the cohort was 2, 3, 10 times as big as that, which it is at some of our competitors. So I think that's the big take home for me, is the small class sizes and the way that we're able to teach you because of those small cohort sizes.
Okay, right. A couple of quite direct questions, which I'm going to couple together. Number one is, can you carry on playing elite sport during your studies? Number two is there a running club? And number three is, what does a typical day look like or feel like as a student? And I think I can pass all of those over to Glenn.
So the first question was, can you carry on playing elite sport? Correct?
Yeah.
I personally am not at that level as much as I would like to be, but our students, most of us have a sport of choice. Obviously, it's not a requirement by any stretch of the imagination, and there are a few definitely that are competing to a high level. It does require, I would say, time management and things. But Lancaster is quite fortunate that specifically for university teams and sports, it kind of sets aside Wednesday afternoons as much as it can for sporting fixtures. So whether that be travelling to other universities or preparing for fixtures, it's definitely possible, yeah, to perform at a high level while at Lancaster. The second question was, is there a running club? So there is a running club. I've been part of it sort of in as much as I could be in the last 3 years. There is no track facilities directly on campus, but there is a running club in town which is accessible by bus about 10 minutes that the Lancaster University Running Club uses. And typically the running club will train together twice a week. So they start from campus and there's a range of different abilities and groups. So there's, for example, there's a couch to 5K group. There's sort of an intermediate group which will do maybe shorter distances, maybe 5Ks, and then the sort of the longer distance group, if that you're that way inclined, that maybe do 10K, for example, on a regular training day. And then depending on, for example, the COVID situation, the pandemic, in first year we have mid-length fixtures and things. So the University Running Club, should you choose to pay for a small fee for a competitive membership, will put on these trips to certain races. So in first year, we all went on a minibus to Liverpool and competed at the Sefton Park Cross Challenge event. So there's definitely a lot of opportunities to get involved in that. And the final question was, what's a typical day? Well, again, it depends on the situation with the in-person or the online teaching, I would say. The last year, a typical day has been a lecture online, maybe, and a practical or a workshop online, but still, you know, the interactive nature means that either the lecturer was in the lab and performing some sort of practical, or the sessions were adapted so that we could still gain the sufficient knowledge through the online medium. But in a more normal time, again, it would typically be a lecture, maybe a workshop or a practical, but with some space in between. So you might get up for your lecture in the morning, then you might have an hour or two where you either go back to your room or you go to the library for a bit of extra study. They then go down to your workshop, which could last 2 hours, and then usually everything is finished in the day by around 6 p.m, 6 or 7 p.m. at the latest, and then you've got the evening to do what you please or get some extra studying.
That's brilliant. Thank you, Glenn. That's great. Thank you. So a related question to that, I think, is a nice contrast is, do you need to be sporty to come and study sport and exercise science? And I'm going to answer that myself, and the answer is no. An interest in sport and health is absolutely beneficial. Do you need to be an elite athlete yourself? No, you don't. And I think we have a very diverse student cohort that comes and studies with us, and they all learn from each other, their own individual experiences that they have and bring to the table, and that's a real key strength. We have another question come in, and I'm going to direct this to Chris Gaffney, if that's okay, because there's two parts to this. Number one is the degree BASIS accredited? And number 2 is understanding the difficulty of COVID. Can you give examples of sports clubs you cooperate with, and is that included within the course?
I think they're fantastic questions. So in answer to the first question, are we BASES accredited? No, we're not BASES accredited. It's something that we've looked at, it's something that we might consider in the future, but it's not something that we feel as a team is going to make you any more competitive within the workplace. It's something that we haven't done at the moment. Certainly all the skills that you require for BASES accreditation, we will give you throughout the degree program. So certainly if you choose to be an individual BASES accredited sport and exercise scientist, all of the degree program that we're going along, all the skills that you're gaining will set you up for that later in your career. In terms of working with sports clubs, we've got a unique opportunity within our second year that our second years can work as an applied sport and exercise scientist for one of our elite university teams. So this is a fantastic opportunity where students can apply their psychology, biomechanics, physiology, nutrition skills to an actual elite university team. And I think being a relatively small cohort, this is something that we can give you the opportunity to do, can work with the teams, so get some real hands-on experience as part of professional practice, which really set you up for the workplace. So in terms of what teams we're working with, we've done some work with the hockey team that I believe Glenn has also been involved in. We do some work quite extensively with the swim team, but we're working with a whole host of different teams across the university. So I guess whatever your sport of choice is, the university does have most sports there, so there's no reason why you can't be involved in those throughout the second year, but actually throughout the degree program when opportunities arise. So I hope that answers the question.
That's great, thanks Chris. Another related question that I think we've got a little bit of time for is, what are the research interests of staff? And I think this links nicely with what opportunities are there available to work with elite sports clubs, because we obviously do quite a lot of research with individual clubs. So I'll pass that back to Chris, if you could give us a bit of an insight into the team's interest.
Hi, sure. So in terms of giving an overview, one of the exciting parts about our team is that we've got such diverse research interests. So my own individual lab, my lab is a lab of integrated physiology. So working out how the body works, what the mechanisms are of how our body changes with health, disease, athletic performance. In terms of the research I'm involved in at the moment, I do quite a lot of work with surgeons trying to maximize their performance during surgery, trying to look at strategies for improving patient outcomes in cancer surgery. I do some things in elite sport. I've got quite a lot of work going at the moment within the space industry. So I do work with NASA and SpaceX, looking at how we lose muscle loss in space. So quite a range portfolio within my own research stuff. In terms of looking at other colleagues and what other work is doing, I'll give a bit of an overview of some of the work that colleagues who are not here today. And then if I'd like to introduce some of the other team to give an overview of their own research, because they certainly know it a lot better than I do. But we've got our biomechanist, Theo. Theo does a lot of work around muscle performance. This is working the domains of both the elite sport domain, so he does a lot of work with Scottish water polo, for example, but also doing work within the health domain as well, so preventing falls and things like that. We've got Dr. Jenny Meggs, our sports psychologist. She does a lot of work with elite swimmers, trying to look at resilience and things like this. She's also doing some work in the surgical domain as well, so working with patients with pancreatic cancer and dealing with resilience around there. I'm going to introduce Dr. Bob Lauder to give an overview of his research, and then we'll go around the team to give a bit more of a complete answer.
Thanks very much, Chris. Yeah, so my research lab is primarily interested in musculoskeletal conditions. The disease, the condition that we are most interested in, is osteoarthritis. And this is a condition that we see across the population. Primarily, it's a condition that we see in older people, but we see it very much in athletes, track and field athletes. Often they get osteoarthritis because of an injury. Now, my research lab, the primary interest that we have isn't necessarily in curing osteoarthritis, although that's certainly something that we've got our eye on. What we're really interested in is understanding the way in which we can diagnose the condition very early. One of the problems with osteoarthritis is that people become clinically relevant quite a long time after the disease starts. They'll experience some pain, perhaps in their knee, that will continue. They'll go to their GP, and eventually a diagnosis of osteoarthritis will be arrived at. But we know that that's a condition that's been developing perhaps for 20 years. So our interest is in determining that early diagnosis so that the clinicians that we work with have a much earlier opportunity to intervene therapeutically, and that is likely to mean a far better outcome for the patient. I'm going to pass over now to my colleague, Dr. Michelle Swainson, who's going to talk to you a little bit about her research area.
Hi everyone, I'm Dr. Michelle Swainson. I'm a physiologist as well as Chris, but Chris I would say is the much more sciencey physiologist, and my physiology is very much more aligned to public health. So I have done my time, should I say, working with elite athletes. I was involved quite heavily in the preparation for the Beijing Olympics, particularly with wheelchair athletes and their exposure to the heat. So I have some experience of working with elite athletes. In terms of what I do currently with athletes, is more around retired athletes and with particular focus on their risk of cardiovascular disease. So I'm a part of the UK Rugby Health Project, and we are currently at the time of looking at our data and seeing what the risk profiles are of those players, because we tend to think, you know, if we're active all the way through our childhood into our early adulthood, that will protect us forever. And in some cases that might be the case, but in rugby particularly, that is definitely not what the data is seeming to suggest. So that's something that we're interested in. The other part of my research is very much around cardiovascular disease, cardiovascular factors. So I do a fair bit of work around obesity measurement, and you know, I don't need to tell you that we're in the midst of an obesity epidemic and we've been in it for decades. So that's something that's really interesting. And the other area is around the use of cardiac rehabilitation and how people will have potentially a heart attack. They'll be entered into a rehabilitation program that might last 8 weeks. And it's about looking at how effective that program is, and quite honestly it's not. So there's quite a lot of work that needs to be done, and we're involved with some of that, particularly with some colleagues over in Leeds and in Blackpool on trying to enhance the cardiac rehabilitation process in the UK. And Chris just gave me the nudge to make sure I also mentioned our colleague Tim. So the now Dr. Tim Barry, who's just completed his PhD, he's very much the sports performance researcher amongst the team. He works very closely with a number of professional and elite athletes on an individual basis around golf, but also on a team basis, particularly in Premier League football. So he is interested in generally the whole sports science domain in terms of enhancing performance, whether that be related to accelerations and decelerations and injury. But his particular research area is looking at the spinal shrinkage in fast bowlers in cricket. So he's got a real wide range of experiences. But again, I hope that gives you an idea that the team have got, you know, interest across the board, and that feeds nicely into how we inform our teaching. Okay, thank you.
Thank you for that overview. I'll add mine at the end in the next Q&A session. So it has gone 11:15, and this is the start of the next section where we're going to take you in a little bit more depth around the lab. So at the end of this section, we've got a further time for a Q&A. So we've still got lots of questions come in, and I can pose those at the end of the next section. So I'm going to pass back to Bob to introduce Michelle again, who's going to give us a tour.
Thank you very much, Sarah. So I hope you've enjoyed the session so far. You've had an opportunity to learn about the degree that we offer here at Lancaster University, some of the features that differentiate that from other sports and exercise science degrees. So I hope that you're thinking that the sports and exercise science degree here at Lancaster University is the one for you. As Sarah said, there'll be opportunities for us to address the questions that I know are coming in But now what I want to do is hand back to my colleague, Dr. Michelle Swainson, who's going to talk to you about the Human Performance Laboratory that we're speaking to you from. And she's going to talk about some of the equipment that's here. This is equipment which you, as a student here at Lancaster, will use. And this is also our research grade equipment. The research grade equipment is that which you would find in other research facilities. And our students get an opportunity to learn to use it so that when they graduate, they're familiar with this equipment, not some other equipment that is allowed only for teaching. So with no further ado, I'm going to pass back over to Dr. Swainson, who's going to lead you on a tour of our Human Performance Laboratory. Michelle.
Okay, hi again, everyone. So it is a tour, it's a virtual tour, so I'm going to try and do my best to do that. So thanks to Jack, who is behind the camera, who will be navigating me around. I appreciate we're not going to be able to zoom in and look at things in loads and loads of detail, but hopefully it's what I have to say around it that is of interest to you. If there's anything that crops up over the course of this 20-25 minutes, you know, maybe you've heard about a piece of kit and you want to know a little bit more about how that's used and when that's used, then by all means, please pop that in the chat, because I'm pretty sure I won't manage to go into the details for everything that you all want to know about. So like everybody has already said, this is our lab. It is our home, it's our specialist facility. It's only used by sport and exercise science, which is great. It means we don't have all sorts of other courses coming in and taking up our space. It is a facility that you are in from day one, or at least within the first year. What we tend to find across the board is it can sometimes take until people get into maybe towards the end of their first year, into their second, but definitely by the third, where they start to spend more time in the lab. Whereas we've tried to make sure that particularly the lab-based modules are in here all the time from the first year through to the second, through to the third. So there is a lot of lab time. And that ultimately is about making you safe and effective in a lab setting, making you feel comfortable in a lab setting, you're having plenty of exposure to the environment, to the equipment, and we have a real focus, or we try to have a real focus on ensuring competency. So what we don't do is teach you a skill and then that's it, done. All right, we move on to the next skill. Some skills will get repeated week on week on week. And what we would like to think is by the time that you get to the end of your modules, that you have a level of competency across a number of tests and protocols. But then obviously you move on into year two. You don't forget the skills that you learned in year one. If anything, we up the level. And we take things to a slightly more advanced level. So it might be that you're using the same equipment, but you're using it in a different way. It might be that you're looking at different biomarkers, for instance, or it might be that we're making more use of the functionality of some of the equipment. And then again, we get to year three and we up the ante a little bit more. So what we're seeing is sometimes we don't need loads and loads and loads of equipment that you get exposure to at different points. Often it can be equipment that is used in year one that we just level up, and everything that we have here in the lab, particularly from a physiological perspective, is things that are utilised out in the field. Okay, and I'll touch on that as I walk my way around. The other thing that's worth bearing in mind, so I am probably going to focus more heavily on physiology because there is more physiology kit in here, but also I am a physiologist, so I feel more comfortable in that domain. But I will touch on some of the biomechanics and psychology equipment as well. And really just to highlight to you that here at Lancaster, we're trying to make you think about sport and exercise science as a full integrated kind of system. Okay, physiology does not sit on its own. Okay, if you're working as a sport and exercise scientist out in the field, you will never just work with physiologists. Okay, there will potentially be a biomechanist, an S&C coach, a psychologist, all different people, so within big multidisciplinary teams. So if we don't teach you about how those things link, then when you're exposed to that environment in the real world, you're not quite as well equipped for it as you can be. So we try to make sure that you kind of see everything as the full picture and not things working in silo. So what I'm going to do is that we're going to slowly move in this direction, okay, and head over to what Chris has just told me he refers to as the extraction space, which is probably a really good example or a good term to relate to it. So it might just look like some workbenches with a few things on top, but this is a really important space within the laboratory and a space that you will spend a lot of time in. Okay, so we'll do a number of things in this space, but it's largely around blood analysis. So what we will teach you, and you'll get taught this from first year, is how to take blood samples. Okay, so we don't go straight in for the veins. Okay, we'll start with the finger prick, and that's really all you really need as a sport and exercise scientist, is how to perform safe and effective capillary blood sampling. So we'll teach you how to do it, okay, and then we'll utilise a number of pieces of equipment so then you can analyse the data that you can get from that blood. So it might be that we have just a small handheld device, so say for instance a Lactate Pro, so it only takes a few seconds to get your results, and they're really useful if we're performing an exercise test. So we will maybe take multiple samples over the course of that test, but you get the results really quickly. It might be that we have to take a little bit more blood, and then we can use a different analyzer that will give us more accurate lactate data as well as glucose data. It might be over the course of your degree, you start to learn more and more advanced biochemistry and metabolism. And you'll hear about a number of biomarkers that could be used, and they're definitely used more in research than they are in practice, should we say, or within a teaching setting. Once you've got the skill set, as you go through the course of the degree, and you maybe get to third year, and you may be that person like Glenn that really likes physiology and metabolism and nutrition, that you get on board with a staff member doing a research project that might require more advanced blood analysis. So what we have here is where we can take blood, venous, through the vein, and we have a very fancy, what probably doesn't look fancy to you on the screen, but it is a really, really good quality, high quality research grade centrifuge. So we can spin down blood, and we can then extract the plasma or the serum from that blood, which then gets taken up to the laboratories up in the biological and life sciences, where we have a -80 freezer, and we can freeze that and extract it and do much more fancy biochemical analysis up there. Okay, we can also do things like urine analysis, and all of that can be done within this space. So it doesn't look particularly exciting, but it's really, really fundamental to a sport and exercise science program. Okay, so we'll go a little bit over here, so I'll just stop. So I'm not going to insult anybody's intelligence and say that we spend a long time doing this, but we will spend time making sure that you can correctly and accurately measure people's weight, their height, their body size, so we'll do waist circumference and all of that. And that ties in really nicely with the bloods, because what we do at the start is make sure you know how to screen an individual that comes through the door. So you learn how to do the full health screening that is required before we would even think about getting anybody on a treadmill or on a bike. So the same screening process aligns whether it's an athlete, whether it's a student like yourself, or whether it's a patient from the local hospital that's come along to join in with a research project. So we have all of that equipment here. We also have some body composition analysis kits, so we can determine your body fat levels and lean mass as well. So you'll definitely have exposure to that. Okay, so it's not particularly exciting, but we have some scales. All right, so if you move around here, and you can see here that we've got the treadmill. So we have one treadmill, and we have two electronically braked bikes, and we have a mechanically braked bike, which I'll explain in a second, and we've just got a new watt bike that will be arriving in time. So not every lab session in physiology or nutrition or biomechanics or whatever has to use treadmills and bikes. Okay, so it's not always exercise based. There's a lot of resting based measurements that might take place, so lung function, for instance. But with the treadmills, so the treadmills are kitted up that we can get you up to, I think we said about 25 kilometers an hour, so we can go pretty fast. Back in the day when I was studying, or even in the time when I've been teaching sport and exercise science, although not here, we would just stick a crash mat out the back of the treadmill and hope that nobody falls off. But obviously here we've got a much higher quality treadmill, so everyone does get harnessed in, everything is perfectly safe, and you ultimately, it might seem quite an easy thing to know how to control a treadmill or a bike during an exercise test, but it only takes a very small mistake and it could all go wrong. So it's really making sure that we make sure that you are very competent, you're very diligent, you've got to pay a lot of attention to detail to make sure that you can do that correctly. So obviously I don't need to tell you the treadmill is there to measure people's walking and running, but what we like to do is, or at least make you aware of, and it's a potential for research projects going forward, is that you don't have to just do a treadmill based assessment on somebody and just look at physiological markers. So yes, you might look at heart rate, you might look at lactate and so on, but you could easily, and we've got one of our colleagues that was doing this, set up a camera at the back of the treadmill, and not only are you looking at their physiological responses, but we're potentially looking at their running gait or their walking gait. So you can see there that you've got biomechanics and physiology working closely together. Okay, the treadmill is connected up, I don't think we can zoom in enough there, but to our metabolic cart. Okay, so we have a Cortex Metallizer, which is one of the best and high research grade metabolic cart, and that lets us gather information around oxygen and carbon dioxide and so on and so forth. It's very complex, and it's one of those pieces of kit that you will learn in a bit of dribs and drabs. So we start with maybe the basics and we just focus on the O2 and the CO2, so you can basically calculate somebody's VO2 max. But as you go through into second year, we delve in a little bit more of the variables that it produces. So for instance, if you were doing an exercise test on an athlete, you might be taking blood samples every so often to identify their lactate threshold. Okay, what we look at from a respiratory perspective, so they'll have the gas mask on, is we can look at the point where the CO2 overtakes the O2, and that will give us an idea of their anaerobic threshold. So, you know, you'll delve into finding out how to identify those key thresholds, and they're really important in both a sport and in a health setting. But also a lot of work around the data. Okay, the exercise test is only part of the story, and you know, it's the data it generates and how you analyze that and how you interpret that. So that forms a really key part of all of our workshops. We don't just spend time running around on the treadmill and riding the bikes. Okay, most of the time is actually dealing with the data. Okay, so we've got a number of bikes here. So the two bikes here, I don't know if you can see them, but these two, they connect also up to the treadmill. Not to the treadmill, to the metabolic cart that's currently connected to the treadmill. And the reason these bikes have been included is that they're so good. If you've got a mix of different types of people that are maybe going to come in and take part in research, for instance, or different abilities across the student cohort, not everybody can maintain the same pace. So when we use mechanically brake bikes, which are the ones where we have to put these little metal discs, okay, to make sure that you're cycling at the correct power output on a mechanically brake bike, you have to be cycling at 60 RPM or at 70 RPM. And if you drop below that, or if you go faster than that, then technically the power output is wrong. Okay, so it's not always that great from I guess, teaching you the higher quality type of testing that we want you to do. And what these electronically brake bikes means that the power output is set. So whatever cadence you want to cycle at, okay, we know that the power output is right. And what's also great about those is that they're controlled by the computer. So you don't have to be pressing buttons all the time to make sure that the protocol is moving in the direction that you want it to do. So that should hopefully give you a taste of some of the physiological kit. Some of the other things that we have, and again, this is a real perk for being part of the medical school, is that with my area of interest in cardiovascular disease, I'm really keen to get students exposed to ECGs. And so we borrow the ECG machines from medicine, and we have a session on electrode placement and interpretation of ECGs, which is great. The other thing that we have here, which is this big space-like machine, is what we call an isokinetic dynamometer. Okay, just pull that down. And this is Theo's baby, should we say? This is our key biomechanics piece of kit that is based in the lab. One, it will not move. This is not a portable piece of kit. It weighs an absolute ton. But it is the key and the gold standard assessment measures for a number of muscular strength parameters. And I'm not a biomechanist, so I can't reel off all of those for you. But what's great about this is that you can look at muscular strength on different muscle groups. Okay, you can look at things together. You can look at left leg, right leg. You know, it's a good way for identifying if there's any imbalances and so on. Again, The test and the exposure to the kit is something that you have from first year. You do a bit more with it in second and a bit more with it in third, and you're more than welcome to utilise it for research projects. So everything within the lab here, we are not precious about in terms of the sense that, oh no, only staff can use that. It's very much there for you to use within sessions, but for you to use for your own research as well. What's really important to highlight from a biomechanics perspective is biomechanics lends itself to a lot of field-based testing or portable kits. So we have a number of force plates. So most of you watching will be aware, or at least I hope you're aware, that you know, we can use force plates. You know, often they might be fixed into the ground and somebody might do a vertical jump, or they might do a box jump and land on it or whatever, and it can work out a number of ground reaction forces and land forces and velocities and all sorts of things that I don't know that much about. But sometimes they are just fixed, and that means that any biomechanics sessions on force plates can only be in this space. So we have some portable force plates, and they can be taken out. So we currently have a student, although I think she's finished her research project now, where she is looking at the difference in force production on back and front squats. So the force plates are positioned within the Olympic lifting racks over in the strength and conditioning suite next door. And you know, and then the participants are there performing their squats, which I'm not going to demo for you at this point in time. And it just shows how versatile some of the equipment is. We've also got a number of pieces of kit in terms of things like the Optojump, which you'll be familiar with. Hopefully, if we manage to see you on our offer holder event, and we'll do more demonstrations on those sessions. But the Optojumps, again, they provide loads of biomechanical information. They're really portable, so we could even put them on the sides of the treadmill. So again, you're getting more biomechanical data out of that. I think that covers most of the biomechanics-y type things. I think what's also worth highlighting is we actually do teach some psychology within this lab space. So some people can view sport and exercise psychology very much in a classroom setting, and you know, and thinking it's all just like talking and therapies along those lines, and that's not how it rolls. And we're really quite lucky here at Lancaster that our psychologist is a bit more of a psychophysiologist, so she understands some of the physiological processes that link to psychological outcomes, or how psychological events may impact on the physiology, and that's a really key example there of seeing how disciplines work together. So Jenny does get students here in the lab looking at, I think we take blood for certain stress hormones, for instance. There's things we can do, salivary cortisol, I think she might do. And she's also got a device which looks at skin temperature. And again, it's just a way to see how maybe an athlete copes under pressure. I don't know all the ins and outs of that, but I think it's highlighting to you that, you know, psychology is equally important within the use of this lab space. And I think that's probably about it. So thank you very much. Over to Sarah.
Thank you. That's great, Michelle. That was a great tour of the lab. It's not the easiest thing to do in these circumstances, but I hope it gave you a flavour of just one of the spaces that we have available for teaching on this course. And it's a space that you would spend a lot of time in. So we have a further opportunity for questions. So please, if you've joined us in during this session, there's a Q&A feature, and it'd be great for you to ask as many questions as you have. We have a few from the last session, and then we have a few that have come in during this session. So from the last session, one that we didn't get to mention was that quite specifically, does the university host any ISAC courses during the 3 years? So ISAC is the International Society for the Advancement of Kinanthropometry. It's very, very specific. So if I pass that over to Bob or Chris.
Hi, I'll take that question. So at present, so ISAC is basically an accreditation you can get for skin fold analysis. So we do have skin fold calipers here. It's something that you will have exposure to even from anatomy in the first 5 weeks that you attend. Definitely, if not, definitely as you move through the course. We don't host any ISAC training here, okay? The university doesn't necessarily host ISAC training here, but the way ISAC works is if you've got enough interest from people to look into getting their level 1 ISAC qualification, then that's definitely something that we can have a look at. But typically ISAC will have a list of locations and dates where they're running training, and that's generally how it works. So a number of my colleagues do have ISAC, but I remember, you know, they went to Birmingham for this, or they went to Manchester for that. So it's not something that we would host necessarily in the university. It might be something that we can look into in the future. What I would say is I think there's a little bit of a and ahhing around the use of skin fold analysis, and actually as a team we would be supporting the use of other body composition measures. So, you know, I guess you would make sure that you have an awareness of the different measures of body composition, so whether that be height and weight in a simple BMI, right through to bioelectrical impedance, skin fold analysis, DEXA, underwater weighing, whatever it might be, so you know how things are measured. And one of the key parts of our module at the end of the first year, the assessing technologies, is to look at reliability and validity and specificity of a number of different methods that can be used and which one is best. And there is a lot of error associated with skin fold analysis, so it's about making sure that we are making sure you're equipped to know about the different assessments. But do we assess it and do we host ISAC? The answer to that is no, but I wouldn't say it's something that we wouldn't promote, in the sense that if students came into second year and they were doing the professional practice module with me, where we try to encourage you to engage in plenty of professional development opportunities, and you found that there's an ISAC course that's happening in Manchester, then by all means we would be encouraging you to go ahead and do that if you think that that would be beneficial for your career going forward. Okay, thanks.
Thank you, Michelle. So the next question for Chris. In year 1, there's the Introduction to Nutrition module. Is there specifically additional studies in nutrition later through the degree in years 2 and 3?
It's a great question. So nutrition is intricately linked to metabolism. Metabolism is all the chemical reactions that go on in the body. So what I would say is, although none of the module titles later in the degree program have nutrition explicitly in them, we cover metabolism all the way through the degree program. So certainly nutrition is an element all the way through. We're looking at how that applies in performance settings, for example. Some of the work in third year, we're looking at how that works in clinical contexts, such as managing type 2 diabetes. So certainly nutrition runs all throughout the degree program. And I know that in this coming year, I'm supervising 2 or 3 students that are doing nutrition-based research projects. So if you're excited about nutrition, there's loads of fantastic opportunities to engage in learning around nutrition and to do some research in nutrition throughout our degree program.
Okay, thanks for that, Chris. So the next question has come in and said, is there specific support for students with learning needs, for example, dyslexia? And I'll take that question if I may. So there's huge amount of support available for students that enter university with specific requirements. And we've already mentioned in the previous session that every student who comes here is assigned an academic tutor for one of the sport and exercise science team, but also has a college tutor who they can speak to outside their degree programme. Now, alongside that, in Central University, there are additional support measures that are put in place. If somebody transfers to us and declares an additional learning need, for example, dyslexia, then they will have an assessment, have a meeting with the central team, and they will develop together something called an individual learning support plan, which generates the specific requirements and needs that's then passed on to the academic tutor to ensure is implemented within the department. And we work with students on an individual basis to ensure that they have everything that they need to achieve their optimum. But it isn't just individual support plans. We have a Faculty of Health and Medicine learning developer Dr. Beth Caldwell, who runs one-to-one tutorials, group tutorials, and offers a wealth of support in developing specific learning issues or areas or struggles that students have, again, to push them on in that academic side of their degree progress. Linked into that, there's an academic writing zone. We have a maths and stats hub group, which again is one-to-one tutorial support, group tutorial support. We have a transitions team, and I work closely with transition team, and that forms part of my research interests in helping students move from further education, maybe A-level or BTEC or another related qualification, and helping them get ready to enter higher education. And that kicks in August, and they will link with us as a department and central teams, and there's a big transitions programme to help you not only get ready to start Lancaster University, but then while you're here to excel and really make the most of your time here. There's peer-to-peer mentoring, and you yourself might want to become a study support mentor for students. And then there is also the Lancaster Success Programme, which I work with, helping students who have come from widening participation backgrounds. Maybe they're the first in their family to go to university, and it's a relatively unknown experience for them, potentially quite daunting. And there is a whole programme of support, both academic, financial, and support to help them really progress and make sure that they reach their potential. So there's a huge amount of support, and it can be very individualized, or it can be a student who seeks it out themselves when they arrive. But definitely something to come and ask more about, and to search the website and have a look at what's on offer if you want some more information around those areas. Okay, so another question that we have, and potentially one of the last ones for this session, comes back to maybe the lab environment and the opportunities to gain work experience during the course. So if I could pass that back to one of the team in the lab, I would be grateful.
I'll take it from you. Professional practice.
Thanks, Sarah. Yeah, that's a really good question. Really important part of making sure that our students, our graduates, are best placed to prosper when they leave us. Across the UK, there are a large number of graduates in the sports and exercise science domain each year. And as we developed our sports and exercise science degree here at Lancaster University, as we positioned it within Lancaster Medical School, we had the opportunity to create structures which allowed us to increase the opportunities that our students would have for professional development, for interacting with entities outside of the university to gain that work experience. And our students are able to do that. They have been able to do that even in the last year when we've been dealing with the COVID pandemic. I'm going to hand over to Dr. Michelle Swainson in just one moment, who can talk to you about specifically about the second year professional practice module, in which exactly those opportunities are embedded. But we absolutely recognise that one of the key things that will differentiate our graduates is the fact that they've studied a sports and exercise science degree from a medical school, but also the opportunities that they've taken to gain experience that adds significant value to their CV. But I'll hand over to Dr. Michelle Swainson, who can talk in a little bit more detail about the professional practice module.
Okay, thanks, Bob. Yeah, so I jumped in on this one because it's my module, so it makes sense to talk a little bit around how we deal with work experience. So Chris has already mentioned we have professional practice that runs through year 1, 2, and 3. The first year is very much around, making sure to, your academic skills and all of those types of things are in place. The second year is where we really start to focus on your career development and starting to nudge you into gaining some kind of work experience. So what we don't do is we don't say you must go on placement or you must get 200 hours of professional development, because it will differ with student to student, and it will also differ with what people want to do with their careers going forward. And also, in my experience, as soon as we say, right, you need to get 200 hours of work experience, that's great for the the really strong students, which I'm sure you all are, that see that as an opportunity to engage. But there's always that risk, oh, I've only got 160 hours, I need 40 more hours, or I'll just go and do that in place X or place Y, and it might not align that closely to what you want to do. So what we do within professional practice is you come in second year and we pretty much suss out, right, what do you think you want to do, with a lot of help and support, and it's not set in stone. And we start looking at job adverts and job criteria and start pulling out what are the key skills that are required, and then it's about setting you up for the course of that second year to start ticking some things off the list, or at least increasing your skill set around those things on the criteria. So one of those might be experience within a lab conducting physiological testing. Okay, what you don't want to do really is go to a job interview and all your experience just be based on what you've done in modules. Okay, so that is valuable, that's where you learn your skills, but it's applying that outside. So we would be really encouraging of you engaging within the lab outside of your studies, and one key area that you can do that, and it might sound like it's not great, but it's really valuable, is being a participant for other people's research projects. The more you have exposure to particular tests, the more you have exposure to particular protocols and lab safety procedures and all of that, then the more equipped that you're going to be going forward. So we would always be encouraging you to do that. Once you get into second year, you might have somebody in third year that's doing their dissertation that requires an assistant. Okay, so it might be that then you come along and you are in the lab acting as a research assistant. So we definitely have one of our current second years that I know of that has done that, and she's gained so much from it, and the value of being in the lab and assisting a third year, or I think a master's student, to conduct that research has really made sure that she's really equipped for then going and doing her own research project. And so in terms of, yes, you will be able to, but we really encourage a bit of self-motivation and a bit of proactivity to, things are not always going to be handed on a plate. So if you're really keen and you want to be engaged in more lab time, by all means, you speak to us and we suss out ways that we can do that. As well as that, you are encouraged to seek out work experience elsewhere. So I have a number of students that are seeking some work down at the local hospital, post-COVID obviously, to get some exposure to some clinical testing. And we've got some really good links with that, as well as links in other organisations, particularly if you want some exposure to sports science testing within elite sport, then Tim Barry is currently offering internships as well to support him as a sports science consultant within a Premier League football club. So I hope that gives you an idea of some of the things that you can do. But in terms of that module, it really is about making a decision and then changing your mind, and thinking that you want to do something and then realising, no, I don't want to do that. And then it helps us to make sure that you are ticking things off on your CV to make sure when you do graduate, you're in a much better place going forward. So I hope that answers the question, Sarah.
That does. That's great. Thanks, Michelle. Question for Chris. This is definitely for Chris, and I'm sure he's ready to answer this one. Do you measure the effects of the environment on the athletes?
So the quick answer is yes, we do. So in terms of working in, well, let me start off with a teaching perspective. So in our third year advanced physiology module, we cover things like altitude physiology, the effects of heat and cold on the body. We cover acceleration, so the effect of G-force on the body, underwater physiology. We're covering all those different environmental aspects and what effect they have, how we can mitigate any of those effects on the athlete. In terms of what we can do here at Lancaster, what we can do in a research setting, in our third year physiology module, we plan to run an underwater physiology practical, for example. So looking at the effects of scuba gear and how that's designed and so on to monitor the effects on the athlete. We can use things like thermometer pills for looking at temperature regulation. We don't have access to things like altitude chambers or environmental chambers here immediately, but we can work with partners to facilitate those for any research purposes. And certainly these are things that you'll learn about throughout your degree programme. But in terms of research, really the sky is the limit because partners want to work with such a prestigious university. So we've got loads of opportunities available. I hope that fully answers the question, Sarah.
That's great. Thanks, Chris. Right, I think it is time to bring everything to a close. It's been an action-packed hour and a half, and I'm very grateful to all of the speakers and all of you for tuning in and sticking with us all the way through, which has been wonderful. If there are any further questions or if that you feel there's anything you've missed, please stay around because we're going to be doing this all again starting at 12 o'clock. And also, if you feel like you'd like to get to know a little bit more in depth about us as a team, please head over to Sport and Exercise Science Subject Resources, where you'll find a webinar hosted by quite a few members of our team, really giving an in-depth insight into their special areas and real areas of interest. So there's a talk by Chris all about what can a sport and exercise do when working for NASA, and he talks about his experiences working over in Florida, and from Michelle about how can a sport and exercise scientist really improve the nation's health. There's even something really special from Glenn, our third year student, where he does a literary spoken word piece all about introducing science communication to the public and how to improve active aging. So that's a really great site to visit for a little bit further information, but please feel free to come back to us and stick around at 12 o'clock. But thank you very much. I will sign off and I hope that we will see you at one of our in-person events coming up later in the year. Thank you ever so much all.